One thing you and I both know about not just our culture, but other cultures is you get invited over to people's houses, and what's the first thing they want to do is they want to feed you,
Mhm.
right? And she was already feeling guilty, so she was restricting. So she had to come up with an excuse not to eat. And her excuse was, oh, no puedo, tengo diabetes, I have diabetes. And so
Mm.
that became a way for her to shield herself from having to engage with that cultural norm while at the same time navigating the guilt and the shame about binging and the abuse that she was going through.
Hey everyone, welcome to Food Culture Curious. I'm your host, Areli Gutierrez, a Latina registered dietitian, and I'm here to explore how cultural inclusivity can transform our approach to food, health, and well-being. Each episode aims to empower you to better understand and serve diverse communities with practical insights, personal stories, and expert advice. If you find this podcast valuable, don't forget to hit that follow button, leave us a review, and share it on your socials. You can find us as at Food Culture Curious. Hey everyone, welcome to Food Culture Curious. My name is Areli. I'm a registered dietitian on a mission to promote cultural inclusion in the nutrition space. Today we have with us a really awesome guest. Ramiro Saavedra is a board certified renal dietitian working in an outpatient hospital setting with previous experience in the treatment of eating disorders. Ramiro is an adjunct faculty at Texas Women's University and the University of Houston. At Texas Women's University, he teaches a graduate level course on eating disorders and eating behaviors. He is passionate about nutrition, cultural foods, and the psychosocial aspects of nutrition. He has spoken at various conferences and given various lectures to many audiences over the years. Thank you so much for being here, Ramiro.
Yeah, thank you for having me again. This is exciting and it's fun.
Of course, and it's really fun to have my first guest back. So, for those of you
Nice.
that don't know, Ramiro is actually the person who hired me at DaVita. So, I've known him for quite a while. We've done conferences together, we've spoken together. And the first time that we recorded an episode, we actually did it on my phone, like sitting outside of a cafe. It was like something brand new I was trying out. So I'm really happy that you went on that adventure with me, and your episode is still one of my top 10 episodes today.
Nice. Let's see if we can break the record with this one.
Hopefully. I was really excited when you said you wanted to talk about eating disorders and how it affects the Latino population. So tell me a little bit about why is this important to the Latino population?
That's such a good question. I'm very passionate about this because one, I think it's a fascinating topic. Two, a lot of people don't realize some of the disparities in eating disorders that still exist. But three, one of the biggest things that, you and I both know is that food is central to Latino culture, and that is central to Latino identity. And so, why is this important? One, there's a lot of shame around this topic, just in general, let alone in the Latino community. And then when we look at it within the Latino community, there's a lot of culture stigma in Latino culture. There's already stigma about coming forward about being sick, let alone telling somebody, oh, I have an eating disorder, and then them not fully understanding what that entails, or thinking that it's just you being weak, or all kinds of notions, right, that exist about eating disorders. Secondly, for a long time, and of course, this has obviously changed in the last couple of decades, but it was long considered a white female disease, right? And we didn't see a lot, and we still don't see a lot of research in this area with minorities, but that is changing. We are seeing a lot more research over the last couple of decades, including a lot of research specifically on the Latin population. There's more data on males. There's also more diagnoses. 20 years ago, we only had about four eating disorders in what is known as the DSM, or the Diagnostic and Statistical Manual of Mental Disorders. Since DSM-5 came out in 2013, they expanded the list of eating disorders. And so there's more diagnoses now that might fit what would perhaps have been either misdiagnosed or overlooked in a Latino or a Latina. And so it's interesting to see how that now fits into the puzzle. One thing we also know is that Latinos are diagnosed at a significantly lower rate when compared to whites and other ethnic groups. One really important thing is something we call a family of origin as it relates to eating. So, a family of origin are the beliefs and things that you were raised to believe about food. So, one important one that comes to mind that's very common, not just in Latino culture, is like you have to finish everything on your plate, right? And
Mhm.
so that's a notion that you grow up with your family, you grow up thinking about, you grow up hearing it, and you can't help but adopt it into your eating behaviors. And there's lots
Mhm.
of other notions. If you're bad, you go to bed without dessert. That can apply to any culture. But there's lots of these family of origin stories within Latino cultures. It's similar across Latino cultures, and it plays a big factor in how we eat. And like I mentioned in the beginning, food is central to our identity. And there's lots of sayings too, right? We call them dichos, right, in Spanish, around food because it's so central to what we eat. I was driving home from work today and I passed by this restaurant that I like to go to sometimes. And one of their saying is, coma tacos, no coma ansias. Don't eat anxiety, don't eat your worries. Instead, eat tacos. And it's a funny saying, and you see it and you don't think anything of it. But I'm going to go into detail just how much that saying says a lot about Latino culture and eating disorders.
Yeah, absolutely. It's flippant, right? It doesn't take the mental health aspect seriously. And just to let me go a little bit back real quick before you get into that. So I know that you mentioned that in the past, this was like a white woman's disease, right? And some of that comes from the beauty standards that are put on women. When you're talking about like how it relates to the Latino culture, you mentioned the Clean Plate Club, how we're told that you want to eat everything on your plate because you don't want to be wasteful. And
Mhm.
that comes from food insecurity. So it's so
Right.
interesting that it's a completely different type of stressor that is causing this behavior.
What made me think about it was I assigned an article for reading. So in my class, I didn't have a textbook because there is no textbook at the graduate level that covers eating disorders in a biopsychosocial manner. So I assigned articles, and one of the articles I assigned was called Las penas con pan duelen menos. The role of food and culture in Latinas with disordered eating behaviors. A lot of these things with the sayings that we have in our culture also do, like you said, directly translate to a behavior that we've learned, right, as we were growing up. But what does it look like in the Latino population to have an eating disorder? When we look at prevalence rates, we know that bulimia nervosa and binge eating disorder are among the higher diagnosed eating disorders within Hispanics, and they're either at the same rate or slightly higher than non-Hispanic white communities. When we look at adolescents, Hispanic adolescents are significantly more likely to have bulimia nervosa than their non-Hispanic peers. Latina women may face additional risk factors, including pressure to conform to that thinness ideal that you were talking about, while at the same time navigating their cultural food norms. We also look at like body dissatisfaction when we look at the research, and we know that there are higher rates of body dissatisfaction among Hispanic girls, which may put them at a greater risk for developing disordered eating behaviors in comparison to white girls, right? We also look at, and you brought it up too, that ethnic discrimination and the stress of acculturation are significant risk factors for eating disorders in Latin communities. And then one interesting predictor too is family conflict. So overall, family conflict is a predictor of disordered eating in anyone in general, but it's even higher in the Latino community. And then you take things into account like food insecurity and how all that is tied into our beliefs, the way we're raised, and our eating behavior. It kind of paints a different picture for what this looks like with Latinos. And so when we look at bulimia and binge eating, I'm going to assume most people know what those are, but I'll cover it briefly. Bulimia is when somebody engages in behaviors that involve purging after eating food, and it could be related to guilt. Also, the purging doesn't necessarily have to be vomiting. It
Right.
could be exercising, it could be restriction, it could be
Mhm.
different things. And people with bulimia tend to be at a normal weight or at an overweight status if we're looking at BMI and height to weight proportions, which is harder to see sometimes because of the prevalence of obesity within the Latino community and other health disparities. Binge eating disorder is also higher, I said, with the Latino community. But when we break down binge eating disorder in the broader umbrella of disordered eating, it's very interesting that it is higher amongst men. And so overall, binge eating disorder is seen at higher rates in certain groups of men. And specifically, when we look at some of the research, Latino men are higher in binge eating disorder. And we know that binge eating disorder is rooted in anxiety and to a certain extent, right? It's
Right.
also a way that people pacify feelings of anxiety. It's a maladaptive coping mechanism, right? That's developed from some type of trauma or something that the person has gone through. But it involves eating higher amounts of food in a small amount of time, oftentimes going well above what is considered to be normal for the average person to eat in one sitting. And this person could be eating 2 to 3 days worth of calories in
Hmm.
one sitting, and that's what we consider a binge. And so it's really interesting to see how these two disorders stand out within Latinos, where anorexia may be something that stands out in another group, right? It's also really interesting to see this idea of body dissatisfaction because we know overall, when we look at body dissatisfaction, both men and women suffer from it, women at higher rates. But the research is showing that men are slowly creeping up in that body dissatisfaction.
That's so interesting. And I remember, especially right working at a gym, being a dietitian, you're around people that want to be healthy. They don't even realize that their behaviors are not healthy. Whenever you go into an exercise class, you'll hear something like, oh, I had a lot of tamales this weekend. I had a lot of tacos this weekend. So I'm here to burn off those calories. I'm doing like extra workouts to burn off the calories and not even realizing that, hey, at a certain point, like those behaviors are actually a form of purging. They're not even aware that they're engaging in these behaviors.
Yeah, and it's so common. And I try so hard to shut this off, but I guess the previous eating disorder dietitian in me can't when I hear things like that, because I
Hmm.
think all of us have some type of disordered eating. Is it enough to clinically diagnose someone? Maybe not. And only either a mental health or a medical professional can determine that. With as dietitians, it's not in our scope, but
Yeah.
you can't help but hear it and you can't help assess it when interviewing your patients or you're talking to your patients, especially when you work in a space like weight management or eating disorders, or really any other space where you're going to encounter people that have in the past restricted for whatever reason, or they've engaged in behaviors that they thought were healthy, but perhaps were not too healthy. And it's hard to see people navigate that without the tools that will help them be successful and overcome it.
Yeah, especially with, and I'm sure you hear this all the time, you walk into a doctor's office and the first thing that they want to promote to improve someone's health is weight loss. You should try losing weight. You should try losing weight. And through that messaging, people are always thinking, I need to be smaller. I need to be smaller. And then that could lead them to engage in some of these eating disorder behaviors.
And there's so much that can be, we can go on a whole nother podcast episode and talk about why we develop these ideals and why is it that weight is such a prevalent metric in healthcare, right? Because
Mhm.
it's one of the first things they get. It's considered a vital sign, right? So they get it when they take your vital sign, and there's different schools of thought on whether we should even consider weight as a metric of overall health status. And if so, what limitations should we put on it? And again, that's another podcast episode in and of
Yeah.
itself. But it is very true. One of the first things that, physicians and dietitians and others will prescribe to improve chronic illness is weight loss. And the research isn't lying when it tells us that, yes, a reduction in weight can improve hypertension, can improve cholesterol. But it does not take into consideration other factors like body composition, right?
Mhm.
And how that can also be a metric of health. Metabolic rate. How is your metabolic rate changing as your body composition and your weight are changing? Doesn't take any of that into account, right? But it's so easy to prescribe and to say, oh, well, just lose weight and it'll be fine. And then on top of that, you've got to navigate weight loss within a society and within a culture where the Latino diet is often demonized for weight loss.
Yep.
And so it's a thing that it's seen as the foods that we eat are seen as indulgent foods when they're just food that we eat every day. And so I don't have to tell you that, and in your audience that probably, but it is something that is very difficult to navigate.
I definitely want to hear what you have to say with when you are having these issues and you do want to eat appropriately for your body. Like, how can you do that with your cultural foods when you have this myth of Latino foods being for overly fried or overly fatty or, like you said, indulgent? So I definitely want to hear you talk about that.
Yeah, and there's a lot of what you brought up at the beginning, the stress of acclimating and acculturating to a different country, to a different style of eating, a different grocery store is a big stressor for people when they move here or when they move anywhere and they're having to navigate that for the first time. But also this idea of this is what the magazines look like. This is what the people here look like. Should I look that way too? And when we look at ethnographic studies and anthropological studies, we know that people's bodies are different in different parts of the world. It's just partly genetic and partly environment why those things develop. And it's interesting to see how that internalizes in people's minds and then how that plays out in how they act and what they eat. But I wanted to talk a little bit about what's important to note with eating disorders in the Latino population and overall community. One thing is we know that we are underrepresented in the research. And so a lot of the research limits the understanding of how to recognize eating disorders in Latinos and how to treat them. So if you can't recognize them, then how can you treat them, right? If you can't screen appropriately. So there was an article that I talked with my class about on how when presented with identical case studies, therapists were less likely to recognize eating disorder symptoms in Black and Hispanic patients when compared to a white patient. Because when we write the books and we write the studies on what eating disorders look like, oftentimes it's centered around American white culture, right? Or European white culture. And it's important to also note that not all therapists are trained equally to recognize this. Depending on what program you go to, you may not even get a class on eating disorders, let alone get specific training on how to identify it in certain populations, right?
Mhm.
And then when we look at diagnostic inventories are usually questionnaires or screening tools that we use to either screen for an eating disorder or to treat or to diagnose and then subsequently treat it. These are often created with data that has limited diverse samples, right? So maybe the data that was used to create the Ramiro eating disorder inventory was very heavily reliant on the population I could get to complete my study. And maybe it was white college students between the ages of 18 and 45, right? So there's already several limitations there. There's an age limitation, there is a population demographic limitation, and then there's a racial limitation too. You only have to create the inventory, back it up with data, have other people the same thing. And then we can say it's a reliable and valid tool. But is it really when we're layering on top of that the idea of culture or race, right, or ethnicity? And so there's a lot of limitations with it. There's some inventories that have been tested in multiple populations. So we know that they're valid and reliable to test in an Asian population, just like in a Latino or Black or wherever we're talking about. But the majority of the ones that we consistently use are not, right? But that is changing. The research is coming out with more tools that are better validated for diverse populations, including men, right? Men are often excluded from that equation. The LGBT population is often excluded from from that group as well. So it's interesting to see that too. And then overall, when we look at what this looks like in the Latino population, it's harder to spot because some of the behaviors, like you said, that people engage in are just so common for us to engage in as a culture. Compensatory behaviors on restriction or giving yourself a reward. Oh, I've had a long day. I'm gonna give myself this. Or even like comes to mind like with my dad. He's gonna get home later, and the first thing he's gonna do is turn on the TV, and then he's gonna have his café con panecito. We do these things, and it's just part of our culture and who we are. But sometimes, when a person is exposed to trauma or something happens, that behavior can become more maladaptive as time progresses, and it can become more severe. Is there anything wrong with having your café con pan? Absolutely not. Have it. But where's that line, right? Where it becomes something more than just evening coffee and snack. Where's the line where it starts to become a behavior that you're compensating for something else? And
Mm.
who is trained to really look at that within the cultural lens and see it for what it is, and then see it when it becomes something more severe? And the answer is not a lot of people.
Yeah.
And that's another thing. It's when we're training healthcare professionals, we don't have a lot of training that's specific to like diverse populations, and then even more specific on eating disorders and how to recognize them.
Yeah, like you say, sometimes it's not necessarily the behavior, but the extent of the behavior. But
Hmm.
it's not the same sitting down with your cup of coffee and your piece of pan dulce versus having three or four pieces of pan dulce. Or
Right.
it's not necessarily the behavior, but like the context of the extreme of it.
It brings me back to when I worked in eating disorders briefly, and it was very interesting to see other dietitians that would come to me and be like, okay, my patient's starting to eat again, and I'm making a meal plan, and they want this pig cookie. Is that okay to have? What is it? And I had to be like, oh, a marranito, and I explained what it
Mm.
was and how it's made. And they're like, oh, I was like, yeah, it's okay to have it. Like, it's a piece of bread or a cookie or it's a dessert. I'm honestly surprised, like the patient's even wanting to incorporate something that's technically higher calorie, higher fat, and higher sugar,
Mhm.
and they're okay with it. And so it was sometimes things like that made me go, but I didn't think about it until fast forward. I'm a more seasoned clinician now, and I see things a little bit differently. Going back to what it looks like in eating with Latinos, I'll never forget this patient. And a long time ago, I had a patient that was suffering from binge eating. And the patient did not actually have that as a diagnosis. That actually came later. I saw this patient in an outpatient setting, and I counseled the patient on diabetes because that's what was in the referral, and that's what the patient wanted to talk about. And so she was like, look, I'm already doing all these things. Can you please also give me some more tips on how I can better control my sugars? And I looked at the labs and I'm like, man, her A1C is really good. Wow, her fasting glucose is good. Man, this person's really taking care of themselves. And so I
Mhm.
proceeded to give more advice, and not knowing what was really happening, I was giving dietary advice on how they could change things up and maybe limit some foods and substitute other things. And everything was fine. The encounter ended and they went about their way. Later on, I get consulted into the psych unit for an eating disorder. And they were like, come on by. We have this patient. We actually want you to partake in the intake process. So, the interview of the patient. And the intake process in an inpatient psych unit is the patient sits at the center and all the healthcare professionals are around. A little intimidating for the patient, but you have all the disciplines present. PT, you have OT, you've got dietitian, nursing, doctor, residents, medical students. This was a teaching hospital, so everyone and literally everyone was in that room, and along with psychologists and case managers and social workers. And oftentimes when they had Spanish speaking patients, they would use me to translate. And so I took a look at the record and I saw a note in there with my name on it. And I was like, I've seen this patient. Who is this? And so sometimes I would have frequent flyers in the psych unit. I was like, maybe it's one of those. But then I was like, wait, I don't recognize this name. And I was like, wait, why did I do a diabetes education on this person? To make a long story short, when we did the interview, it was discovered that the patient never had diabetes to begin with.
Oh,
The
wow.
patient was lying to their healthcare providers about having diabetes, but not in a malicious way. This patient was suffering from trauma and abuse in her relationship. And one of the things that would happen is that she would get a lot of anxiety and stress because she knew that maybe when her partner came home, that abuse was going to happen. And in anticipation of that abuse, the patient would eat and binge on stuff. And then the abuse would happen. And afterwards, she felt guilty about the binging. And so she would restrict. One thing you and I both know about not just our culture, but other cultures, is you get invited over to people's houses, and what's the first thing they want to do is they want to feed you,
Mhm.
right? And she was already feeling guilty, so she was restricting. So she had to come up with an excuse not to eat, and her excuse was, oh, no puedo, tengo diabetes, I have diabetes. And so
Mm.
that became a way for her to shield herself from having to engage with that cultural norm while at the same time navigating the guilt and the shame about binging and the abuse that she was going through. And it was at the time, I was just like, what is happening? And I was just very surprised by it. Fast forward to what I know now, I'm like, wow, that was so horrible for the patient to have to go through that abuse, then binge with from the anxiety of it and the trauma, and then the response then is restricting, and then knowing that her culture pushes you to eat and it's out of sign of respect when you go to people's houses and things like that. Her concocting a whole story about a disease she didn't have as an excuse to cover up for the restriction, which was covering up for the binging, which was a response of the abuse. Like that in itself is just wild to think about as a clinician, let alone as the patient who had to live that, right?
Mhm.
And so one thing we do see a lot of is stress eating with Latinos. There's a lot of stress eating. People, everyone does it, but when we look at the Latino population, there's a lot of stress eating. And it could be stress eating related to finances. It could be
Mhm.
things related to their immigration status. It could be all kinds of things, behavioral problems with their kids, problems in their marriage. It doesn't matter, right? But we engage in a lot of stress eating behaviors. And that becomes a coping mechanism of how people then deal with that stress. And that's when it becomes maladaptive. So I thought that was really interesting to see in clinical practice and how when you layer the cultural identity with the food, with the diagnoses, with the patient, and it just becomes this really complex web of something.
Yeah, absolutely. Like you said, a lot of clinicians are not even trained to look for something like that. I'm pretty sure you never expected someone to lie to you about having diabetes.
Yeah.
So, all these different stressors that can affect us and that can be shown in these ways. So, speaking of, since you mentioned this earlier, Latino cultural foods and the stigma that's behind them. Do you ever see in the eating disorder space that they're hesitant to embrace their cultural foods because of the stigma that's around them? I know that at least I've heard in my own friends and family, like, oh no, that like flour tortillas, those are bad for you. Or pan dulce, that's bad for you. Those are bad foods. And then they'll have a little bit of that fear if I have them, then I'm a bad person. Have you seen anything like that in the eating disorder space?
For sure. And it's more common with eating disorders that are restrictive. The restrictive bulimias and restrictive anorexias and some of the other eating disorders where there is a lot of hesitancy to re-add their foods because they've been trained to believe that they're not healthy or that it's not a good thing for them to eat. And there's also a lot of hesitancy to talk about the why, like why
Mhm.
they don't want to do it, why they don't want to reintegrate the food. And then the recovery piece is a little bit harder for them because they've got to navigate, they have to navigate not only recovering from an eating disorder, but then recovering from an eating disorder while at the same time navigating what their culture believes about eating disorders, their social support, or sometimes lack thereof when coming back into normal day-to-day activities after, let's say, being in residential eating disorder treatment or having intensive outpatient eating disorder treatment and then reacclimating. A lot of people do avoid it, but some people are really happy to get back to it. Like they're happy to hear I can have these things. Oh, great. Okay. And normally, our problem, depending on the disorder and the patient, is not them overeating. Sometimes it's undereating. And then sometimes it just depends who we're talking to, whether or not that stigma exists, because they've got to think about too, like when they're coming back into whatever part of their life they're coming back into their marriage, back to college. They've also got to have to navigate the events around them and the environment around them, and whether or not that environment is supportive of their identity in the first place, let alone their foods, right? So yeah, that is a big one. But a lot of our dietitians that practice in that space constantly have that conversation with patients about navigating that fear, especially in the weight management space. Eating disorders and weight management to me almost feel like they're back to back because you can very easily get into eating disorder territory when working in weight management. And there's a lot of patients that go through weight management treatment while actively having some type of disordered eating. Maybe they don't have a diagnosable eating disorder, but they are actively engaging in eating disordered or disordered eating behaviors, and that sometimes makes it difficult to treat because there's that fine line, and some clinicians are comfortable crossing the line and getting the patient back on treatment plan, and some are not. So there's that aspect of it too. We see it quite a bit in weight management for sure. I don't practice in the space, but I work in it, and I do hear a lot of that from my dietitians and my mental health professionals.
And also working with specifically the Latino population and how there are higher rates of Latino patients that are doing the binge eating and compensating because they have all this stress, and we have so many reasons to be stressed, especially nowadays. But I wonder if, and I don't know if you want to comment on this, is that we don't have a lot of healthy outlets for the stress. Do you know what I mean?
Yeah.
Like, I feel like food is pretty much food and gossiping is pretty much the main thing that we can do,
Yeah.
because there is that stigma on therapy. There is
Hmm.
that stigma of even resting. Resting is something that
Oh
we're not
gosh.
really allowed to do. You're not allowed to just sit. If your mom or dad sees you sitting down, just watching TV or just taking a nap, they'll comment on it, right? Like, oh, there's so many chores that need to be done. How can you just be lazy? So you don't even get the chance to recenter to, God forbid, you want to do something creative like watercolor, or you know what I mean?
Hmm.
These are seen as like silly things to do with your time.
Yes.
So how are you supposed to de-stress when all of these avenues to de-stress are closed off to you?
Oh my God, you're like you're speaking to me right now. My parents have been staying with me for a month or so. My dad's been ill, so I took him in and said, "Come stay with me until you feel better and whatnot." And that mentality of work, I'm guilty of it. I'm talking to the guy who does a million and one things, and I take time to just relax and chill. I have to do it more often, and I do have to remind myself of it. But like you said, it's like sometimes eating and gossiping are the two outlets that we have as Latinos. We often don't think of gym, or we don't think of things like watercolors, doing something creative, writing a book, journaling. Like we don't think of all the other outlets that are out there as a way to cope with the stress other than eating. My mom has been here for some time with me, like I said, and she's like a nonstop workaholic. Even for me, I'm like, Mom, chill out. And she's, I don't have anything to do. What am I going to do? And so one day I came home from work, and my dad has no problems relaxing. He'll turn on the TV, he'll be there for hours, or read a newspaper, or read his Bible, or whatever. I came home, and my dad is recovering, and my mom should take the time to do some self-care. And what is she doing? She has a bucket and a rag, and she's cleaning all of my baseboards in the house. And I'm like, why are you cleaning? She's, oh, because there's dust. And I noticed it. And then when I noticed it in one, and I was like, okay, so leave the dust, leave it alone. Like it's not going to do anything. And she refused. She would not stop until she was done. And at first, it really bothered me. And then after a while, and I'm like, putting myself in her shoes, I'm like, here's a lady who doesn't know anything about what's going on with my dad, at least not like from the scientific healthcare perspective, doesn't have a lot of education in her background, and as a child was probably not given any outlets to express herself, or let alone de-stress, be able to relax on things. She's been like the worker person her whole life, and I had to come to terms with the idea that maybe this is her way of de-stressing or not thinking about all the things that are going on with my dad. And at least she's doing something active. She's rearranged all the rocks in my front yard. Like she's done all kinds of things. But yes, like I told her one time, I'm like, Mom, I have a ton of magazines. Do you want to read some of them? And she's, no, why would I want to do that when there's work to do? And I'm like, okay, I give up, but here's the magazines if you want them. I'm like, here's some books. I was like, here's some crossword puzzles. I even gave them, like, for Christmas, a book about to tell me their story. Quiero saber tu historia. I want to hear your story. And I'm like, why don't you work on that book that I gave you? You can write your story down. She's, no, I'm gonna go outside and trim the trees and the bushes. I'm like, all right. But
Yeah.
yes, it's very prevalent that as a culture, society, I think the younger generations are getting it, but the older generations are still stuck in that workaholic mentality. And then the guilt that comes because you're sitting and doing nothing. And I had to have the conversation with my mom when we were in the hospital. Like, we were in the hospital for almost 10 days or so. And I had to tell her, like, Mom, there's nothing to do here. You're not going to clean. We have to be here for my dad. Like, we have to help him with stuff. But when he's okay or when he's asleep, like, rest, because otherwise you're not going to get a chance to rest later. He's going to be waking up at night. They're going to be coming in to do vitals. This is your time to rest. So I think she took it more seriously then because there really wasn't anything to do. Like, she
Hmm.
wasn't going to clean in the hospital, and she only brought so much stuff to keep her busy, and the rest of the time both of us were looking after my dad. But yes, it's a very prevalent thing that I think younger generations, one, are becoming more aware of it, and
Hmm.
two, are trying to break those cycles of it's okay to sit down and do nothing one day. I came home stressed. It's okay to not do something for a couple hours and then figure out what I'm going to do for dinner or whatnot.
Yeah. And that's something that even I'm still struggling with. You grow up just in the grind, right? Working three jobs, putting yourself through college, trying to escape food insecurity, escape poverty, and then you get to a point in your life where you can put the brakes on a little bit, but you just don't know how.
Yeah. Yeah, you don't know how, and then even if you do know how and you do it, there's still in the back of your mind, there's still a sense of guilt of, am I doing this? Am I doing this too much? And then you got to remind yourself, like, no, just take the time that you need and do it. And I say that having needing to do that for myself at this point, at this moment. But it is so prevalent for to still feel that. And
Yeah.
we can go into a whole podcast episode about that for sure.
So right now you mentioned the younger generation and how they're becoming aware and hopefully they're breaking the cycle. And I see a lot of videos, especially on social media. So that's like the positive side of like social media, right? But let's talk a little bit about the negative side of social media and how that affects like Latinos and eating disorders. What can you tell me about that?
Oh yeah. So I had a whole chapter just on social media because it's gotten so big in the last just 10, 15 years. It started out with just like MySpace and Facebook, and now there's multiple platforms, multiple ways that people consume information. The literature is telling us that most people are getting their news from social media and likewise are getting their health advice from social media. So you
Yeah.
and I as dietitians know that's something we fight all the time is all the myths and things on social media that people are pushing that may or may not be evidence-based, may or may not be healthy. But what we see a lot of it is that social media is adding to this idea of that thinness ideology for everyone, Latinos for sure, especially when you look at our culture and people are curvier. Our body composition is different. And then you have to engage with what social media is telling you is considered to be pretty or beautiful. And then there's lots of diet trends, right? And so back in the day, you had your neighbor that told another neighbor, no, pues que estás haciendo la dieta de la sábila o que la dieta aloe
Mhm.
vera diet or this other diet. And comadres would pass it on from one to the other. You don't need that anymore. Now you can just open your phone and get ten very terrible diets that you can follow. And
Yeah.
you'll lose weight, but you'll compromise your nutrition status in the process. And so there's a lot more sharing of those ideas at a much more rampant and fast rate than ever
Mm.
before with social media. And so those diet trends that we try to warn people about now become something that people are bombarded with all the time. And then looking at English Twitter or English TikTok, and then looking at Spanish TikTok, like almost two different worlds. And then when
Mm.
you break it down in within the scope of food and then break it down within the scope of eating disorders, there are a lot of, this goes back to the positive side of things. There are a lot of eating disorder accounts where people are just talking about their experience and bringing awareness to the topic, and they have good intentions behind it. But then some people may take that and run with it, right? So somebody may be talking about their recovery and saying, "This is what I did when I was deep in my eating disorder, but I'm a lot better now." People will not listen to the "I'm all better" and will then go and look at, oh, what were they doing? Oh, and they lost weight. Oh, and then they start engaging in the behaviors.
Wow.
And it's pretty wild. Everything from restricting all the way to abusing medications like insulin. Another thing is that image standards are changing. Just like you had a lot of this thinness ideology, you are now seeing a lot of social media campaigns engaging in body positivity and embracing larger bodies and the health at every size movement. And we're seeing a lot of that too in social media. But we're definitely seeing something really interesting right now, and that is the pressure for men to look a certain way,
Mm-hmm.
which pressure has always been there for women for since the beginning of time. And there has been to a certain extent non-tangible things that men were held to, like how you speak, how you carry yourself. But now there's a lot of pressure for men to look a certain way. And it's starting very young with boys right now. And I talked about this with my staff. I did an in-service with them. And I told them how like something like looksmaxing is becoming a thing for boys. So I don't know if you've heard what looksmaxing is,
No.
but it's scary because it's things that boys and men are doing to be to have the ideal body, sometimes even the ideal face. And it can
Mm.
go as far as them wanting to engage in plastic surgery or implants or things like that at such a young age.
Yeah.
We didn't hear that from boys at all until maybe later. We're seeing that much younger men are becoming more obsessed with the way their body looks, with
Mm.
musculature,
Yeah.
with working out, with eating clean, with we're seeing a lot more men using testosterone replacement therapy much younger than what it
Mm-hmm.
was been indicated in the past. In the past, it's been indicated after a certain age when your numbers look like this. And now with the availability of testosterone replacement and anabolic steroids very freely available online,
Yeah.
content creators are coming out and saying, this is how you do it. You order it from here and you do this. And now, before, to get that information, you had to go to a gym where that culture was prevalent. Now
Mm.
you can just open a content creator and search for it and find a guy who's willing to tell you how to do all the things, where to get all the stuff, how to dose. They're even telling you what to look out for, what to tell your doctor. Like it's
Oh,
gotten
wow.
pretty wild. And looksmaxing, if you want to take a gander down that avenue, is basically all the things that men and boys are now doing to try and look a certain way. For example, training your jaw, a big defining feature of what it means to be like an alpha male, and it goes down a terrible rabbit hole. But it's this idea that like you have to have a sharp jawline and that round jawlines are not desirable. So people have been buying devices that they put in their mouths to work out their jaw muscles. Problem is, there's no one way to target fat in one specific part of your body. When you either gain or lose fat, it's a more of a holistic thing. And you can target exercise for a muscle, but that doesn't necessarily mean you're going to lose fat in that area. You can gain more
Mm.
muscle, but doesn't mean you're going to lose fat. And what it's doing a lot too is that it's messing people's just creating TMJ issues and all
I
kinds of things
bet.
because people think they're trying to mold their bodies. And it's very much impressionable right now in
Mm.
young boys, especially Latino males, because there's a big push right now amongst young men to be these alpha men. And that has always been present in Latino culture through machismo, that idea. But it's even more magnified now when the narrative on social media and the narrative for young men is that young men are lost and they don't have a sense of what it means to be a man anymore, and masculinity is under attack. You couple that with the machismo that already exists in our culture, you
Mm.
get a very dangerous recipe for lots of things that then have political consequences, they
Right.
have familial consequences, they have societal consequences, and then personal health consequences too. So I'd say, yeah, social media is doing a good job of certain things, But when it comes to the eating disorder space, it is really mixed. Anecdotally, I will say, because there is research that can go both ways, but anecdotally, I will say there's a lot more dangerous things on social media when
Hmm.
comes to the eating disorder space than there are helpful things. And
Yeah.
when you look at the Latino population, it may be a person who does not have the ability to discern whether this is fact or non-fact,
Hmm.
right? Or fiction or a lie,
Absolutely.
or whether this is normal or extreme behavior, right? When it's presented as normal in the video, right? So it's a lot of those things we have to consider. A lot of that plays into too, like what is the role of parenting when it comes to these things, when it comes to young people, and then also what is our diligence as healthcare providers to educate the public on how to discern between these things, and specifically with Latinos, if they lack formal education, how do we get them to understand who's a friend and who's a foe on social media? So it gets really complex, but it's a great question. It's a great topic too.
Yeah, that's why I'm really grateful for the creators out there, especially other dietitians, doctors, healthcare professionals that are out there like
Yeah.
debunking myths
Yeah.
and sharing their personal stories about their eating disorders and how this is how I used to look. And I thought that when I looked this way, I was going to be so happy, but actually, I was so miserable because all I thought about was food. All I
Food.
thought about
Hmm.
was counting my calories, counting my carbs, counting everything.
And logging it into the phone.
Exactly. So, yeah, I'm really grateful for those content creators that can at least shed
Hmm.
a little bit of light on that. Awesome. I think you mentioned a little bit about treatment and like how you would approach that in a culturally inclusive way. I definitely want to make sure we talk about that.
Yeah, yeah. So it's a great way to wrap up our talk today. But one thing is to consider the cost of care and the socioeconomic barriers. As a whole, eating disorder treatment coverage through insurance is really difficult. And if you can't cover it with insurance, then you're going to have to self-pay. You're going to have to pay cash. And some people may not be able to afford it. So just the
Mhm.
access to a professional in the first place is hard, let alone a professional who's trained in eating disorders, let alone a professional who's trained in eating disorders and diverse populations. Like that narrows that down so much. So a lot of people don't get treatment because of that. And you look at Latinos, that number increases even more for all the reasons we've already mentioned, not to mention cost. Another piece is working with your healthcare team or your treatment team to make sure that all foods are accessible without limits or without fear, and being able to talk through. So, successful treatment looks like being able to have a conversation with your care team and being able to come to a conclusion about incorporating a food that you may have thought was bad. Before
Mhm.
there's that dichotomy of good, bad, and then a food that maybe in your culture is something that's seen as indulgent, but you just want to have it. You just want to go back to normalcy in your eating pattern. And so incorporating cultural rituals is important in recovery. Looking at what to do with holidays is important in recovery, especially holidays that involve a lot of food, like we're in Lent right now and people observe it. They love all the my mom has been cooking Lent dishes since it started. Lentejas and habas and nopales and fish and all these other things. But taking that into consideration too in eating disorder recovery, and then adding foods specifically to the treatment plan that make a person feel like their culture is coming back into the spectrum of their eating. And when we look at that, like a lot of times, if you don't make your healthcare provider aware of these things, they don't know that these are things that are important to you. So with patients that are in recovery and treatment, it's really important that they speak up about it. And for us as healthcare providers, it's important that we listen. The other piece of it too is when we have a patient that's in recovery, we always like to have a relapse plan. Like, what's your
Okay.
plan in case you relapse? And what happens if you have a short lapse? So you have to have a short-term plan and a long-term plan, right? And identifying who are those people that you can lean on. It's definitely not going to be your tia that shames you about XYZ, right?
Yeah.
It may be your sister or your brother or a cousin that's more positive about those things, right? So identifying who's my social support that's truly on board with me and really understands this, and then what happens if I have a short lapse? What if I just have a short lapse one day? Figuring out what to do and how to come back from it is really important. And then long-term relapse prevention is also important. So what happens if then I really fall off the bandwagon? Where do I go? Who do I get? Who do I speak to first? Having a plan is super important for these patients, and incorporating their family systems, which are really important to Latinos, into that plan, incorporating religion, because sometimes religion is very important to people. And some people are very active in their religion and they attend services and they go, maybe I'm going to pretend someone's Catholic, and they go to confessional and they go to the youth groups and they go to these things. And that's important to add into a treatment plan and a recovery plan because they're going to have to engage with food in those
Right.
spaces, right? You're going to have to plan for when you go to parties and things like that. And sometimes you can plan for stuff and sometimes you can't. Sometimes what we tell patients in recovery is make the choices that are the best for you in that situation and be okay with them. And don't be so hard on yourself if you went somewhere and you couldn't make a choice that was within your plan of eating that we've created. Eventually, our goal is for them not to follow a meal plan and to just eat normally, intuitively. But again, difficult to do when you layer on top of that all of the things that we believe in our culture about food. And then, like I said, more important than ever is that family and social support and making sure that they understand that those cultural foods are okay for you to eat. If you discuss your treatment plan with your family and you involve them, then they're less likely to bring up incorrect notions about food or your eating disorder. A lot of what happens in eating disorder treatment involves family. There is a lot of family therapy that happens. A lot of eating disorder treatment facilities and programs have things that family members can attend on their own
Mhm.
without the patient so that they can ask all the questions that they may feel uncomfortable asking in front of their loved one who's a patient. And sometimes the questions come up about culture or religion or practices that are important for a person to observe if they're going to be successful in the treatment.
Yeah, family is very important. That support system is so important. So I know the audience usually listening to this is, for the most part, healthcare professionals. And in case that they have any patients, or if there's someone themselves that is worried about potentially having an eating disorder, they're interested in seeking treatment, do you have any resources that you could point them to?
Yes, so if you just want data on it, the National Institutes of Mental Health has a lot of good data on it, but both for the public and for healthcare professionals, the National Eating Disorder Association has a great website, and they have resources for patients, resources for healthcare professionals, and they even have screening tools where I think I may have one. Click here and take this assessment, and then speak to your doctor about the results and see what you get. But the National Eating Disorder Association has a lot of great resources for patients, for family members, and for healthcare professionals. They even have some resources on like how to talk to a family member about it. Then after that, you can also, there's a few places where you can look for a provider or a center that does comprehensive eating disorder treatment. And then that can connect you to something more local in within your community.
Perfect. Wonderful. Thank you so much again, Ramiro.
Yeah.
This was insightful. It was great to talk about. Did you have any final thoughts?
No, I think clearly I really like this topic. I talk a lot about it. But two, I think just having me on, I really appreciate that we can get this information out, that healthcare professionals can listen to it just like anyone else can listen to it. And at the very least, we're helping with the awareness piece. So I want to thank you for having me on. And I'm very thankful to be able to share the information that I know and be able to broaden that horizon for people, whether it's a healthcare professional or just someone in the general public, being able to talk about it and spread that awareness, I think is key because the more we talk about it, the less stigmatized it is and the more normal it is for people to be willing to share with their providers and with their family members.
I love that. Perfect. Thank you so much, everyone. We'll catch you next time. If you are interested in supporting this podcast, you can buy me a coffee at buymeacoffee.com/food culture curious. Or as always, you can support by sharing, following, or rating this podcast. Every click from y'all means the world to me. And now for a quick disclaimer. Food Culture Curious is for educational and entertainment purposes only and does not take the place of medical advice from licensed healthcare professionals. If you need to seek medical advice, please speak to your healthcare provider. Thank you for listening.